All righty. Good evening, everyone. And thanks for joining our Men's Health webinar. We're so excited to have the opportunity to share important men's health education with the group tonight. My name is Lee, and I'm the host of tonight's event. I'll start with a couple quick housekeeping items, and then I'll introduce our speaker. Most importantly, your participation is completely anonymous to other attendees. No one can see your face or your name, and any question that you ask will only be seen by myself and Dr. Kim. We encourage interactive presentations, so if you'd like to ask a question, please type it in the chat box at the lower part of your screen, and we'll save time at the end of the presentation to answer as many questions as we can. Tonight's webinar will be presented by Dr. Christopher Kim, a urologist and men's health specialist at Georgia Urology. Dr. Kim, I know your time is in high demand, and I thank you for your willingness to be with us this evening to share education with this community. I'll turn it over to you.
All right, thank you so much. First of all, thank you for everyone for attending. It means a great deal for me and the community. And I think the first step is knowing, getting knowledge. And this is the first step for everybody that's listening to this talk. So I commend everyone here for doing that. A little bit about myself. I am a urologist at Georgia Urology. I practice at the Duluth office as well as in Lawrenceville. I hail from New Jersey, where I obtained my PharmD practice as a pharmacist prior to attending medical school at Rutgers Robert Wood Johnson, and I trained in urology at Duke University Medical Center. So first of all, what is erectile dysfunction? So in the grand scheme of things, it's the inability to achieve an erection firm enough to undergo sexual activity. About 20% of men 20 years or older definitely are in the population that experience erectile dysfunction in their lifetime. About half of those men over 40 experience some degree of erectile dysfunction. And this is a disorder that affects about almost 40 million American men annually. So the penis is a very neurovascular organ. So if you see in this picture, in order to get erect, you need to have patent or open blood vessels. It needs to have nerves that communicate and veins that communicate as well to trap the blood in the penis after sexual arousal. So at any point in time, any one of these components that don't work, you will get some form of erectile dysfunction. So erectile dysfunction, in the grand scheme of things, it's a snapshot of your overall health. So it's not just one component that affects or is the critical marker that is the root cause of erectile dysfunction, but rather it comes from a lot of different avenues. So your heart health, your diabetes, if you are not well controlled or not well controlled, if you have neurological disorders, what kind of medicines are you taking? Some of the hypertensive or blood pressure medicines can cause erectile dysfunction. If you've had prior pelvic surgery or any sort of operation, in the scrotum or penis, you could affect the nerves. So a lot of these components can kind of conglomerate into causing erectile dysfunction. So like I alluded to before, erectile dysfunction is in connection with your overall health. It's sort of an early warning sign, so to say. So diabetes definitely has a close connection to causing erectile dysfunction. Again, well-controlled diabetes versus poorly controlled, you will see a huge discrepancy in how many patients are affected with erectile dysfunction. Going back to heart health, the way I think about this is that happy heart, happy penis, happy erection. So if you present to your primary care doctor initially with erectile dysfunction, it is a marker of potential heart disease. So this is not something to take lightly in the sense that in 2 to 3 years, men that initially present with heart disease or erectile dysfunction rather can present with symptoms of heart disorders or heart disease. So look at the size of these arteries in your body, going from the smallest to the largest. You can see the penile artery is only 1 to 2 millimeters in diameter. So any sort of blockage or plaque or damage can really cause and wreak havoc to your erectile function. As you can see, almost at 50% blockage of that penile artery, it will cause erectile dysfunction or some form of sexual dysfunction. So this slide just kind of illustrates the link of testosterone with erectile dysfunction. So in my practice, when a new patient comes in with erectile dysfunction, I do always talk about, testing for low testosterone levels, as this, treating this can augment your erectile function as well. And some of the most common symptoms that are associated with it are diabetes, obesity, high blood pressure, high cholesterol as well. So what are some of the options for low testosterone? So there's gels, patches, injections, testapel implants, oral supplements out there that can help increase your testosterone levels. So erectile dysfunction after prostate cancer treatment is also a very common avenue where we see patients. So as you can see in the pictures, the prostate is nestled in between the bladder and the urethral sphincter. So in surgery, when we remove the prostate, you will cut the nerves and spare the what we call the neurovascular bundle as the nerves kind of nestle around the prostate. So you will have a effect post-operatively where you will have to undergo what we call penile rehabilitation in order to get your erectile function back. And we'll talk about this later, but usually after a prostatectomy, it takes about anywhere from 8 to 12 months to slowly regain that erectile function. Peyronie's disease is something that we'll touch on briefly. It can be a talk in and of itself, a lecture in and of itself, but essentially what we know about it is that it is caused by micro trauma or damage to the penis over time and causes a fibrous or hard plaque or scar tissue in the penis, causing a penile curvature with painful erections. And this in and of itself can cause complications and make treating erectile dysfunction much more difficult. So let's go into some of the treatment options that we have for erectile dysfunction. So these treatment options are in no way step-by-step format. A lot of patients with a lot of different medical conditions can choose different options based on what they come with. But we tend to start with pills. Then we can talk about injections or urethral suppositories or even vacuum erection devices. And then the penile implant, which we'll go into later. But in no way, shape, or form, this is in chronological order, or you also can use combination therapies. For instance, I have patients that are on oral medicines and a vacuum erection device, and it works for them. So that's just a snapshot into what we can use. So the pills. So how do they work? Simply put, they increase blood flow into the penis. Now, you should consult with your cardiologist or internal medicine doctor prior to make sure your heart is healthy enough for sexual intercourse. Some of the side effects you could have are headache, flushing, upset stomach, and some of the medicines, there's a lot of them, but they're cousins of each other, and some of them may be affected by food or fatty meals, and you just need to time them appropriately before taking them. The injection. So just from the look of it, it is one component of this is that spontaneity is not always there. You keep this injection in the refrigerator and you need to self-inject about 5 to 20 minutes prior so that erection may develop. In about 40% of men, they discontinue therapy typically in about 6 months due to penile pain. You could develop some scar tissue under the skin as well. And it's not for everybody. For instance, if you're on a blood thinner, this would not be a first option to use. The vacuum erection device. There's plenty of websites or Amazon.com where you can purchase this. Our office does provide some vacuum erection devices as well that we sponsor, but in essence, it creates a vacuum as you pump the penis and traps the blood into the penis and you apply a ring so that that keeps it in place, the erection in place. Now, it does cause some discomfort or bruising, sometimes penile numbness, but most patients, about 68 to 80%, do say that they have a satisfactory erection for sexual intercourse. The urethral suppository. So this is another option where you apply a applicator into the penis and you deliver a pellet and you wait for about 5 to 10 minutes for it to work. What happens with it? So most side effects include genital pain or urethral bleeding or burning with urination. But in about 40 to 66% of patients, it does cause an erection sufficient enough for sexual intercourse. Now, the penile implant, how does this work? So it's an internal, completely concealed device. You have multi-components. It's called a three-piece component penile implant. And we'll kind of actually go into a video demonstration of this, but essentially you squeeze the pump in the scrotum, and that draws fluid from the balloon in your pelvis and puts fluid into those cylinders where you're able to have an erection sufficient for sexual intercourse. 98% of patients report erections excellent or satisfactory. And, some of the common side effects are mechanical malfunction of the components or genital pain or infection. So as I mentioned before, this is a three-piece penile implant with those three components, the pump, reservoir, or the balloon, and the cylinders that are in your penis. And this particular penile implant has a built-in antibiotic coating to it as well. So we'll demonstrate a video of how this penile implant works. So as you can see, the patient is squeezing the pump in the scrotum, and that draws fluid from the balloon here into the cylinders and causing the patient to have an erection. And then when he's done, he activates or he presses the deactivation button right on top, and the erection goes down. So what can you expect after the procedure? Usually this is an outpatient procedure under general anesthesia. You'll have a small incision and you'll take about a week or so for the incisions to heal. And then we see you back in the office in about 4 to 6 weeks to teach you how to use the pump, make sure everything else is going okay before we give you the green light to engage in sexual intercourse. Insurances, we live in the age of multiple insurances and government programs. So for the most part, Medicare and Medicare Advantage programs do provide coverage for this. But we can work with you in terms of if cost is a barrier to make this treatment affordable. So as with any surgical procedure, there's possible risks. The risks of the penile implant can pose infection, damage to, structures where we're working, and mechanical failure of the device itself. It is a foreign body implant that we're putting into the body. And, men who have other medical conditions such as diabetes, heart conditions, spinal cord injuries may have a higher risk of infection or complication. So what are some alternatives? Again, the American Urologic Association does not support these methods of treatment, but there is shockwave therapy, stem cell, and plasma therapy as well. So like I alluded to before, ED is a very common problem. It affects a lot of men, and I commend everybody who's on this who's listening to this talk for listening to this because that is the first step of to knowing what you're dealing with. But the penile implant can be a very long-lasting and satisfying solution. This is where I practice at the Duluth and Lawrenceville office, and we'll start taking any questions. And this is a QR code if you would like to make an appointment to talk about your erectile dysfunction. And if you